Welcome to the call. We're going to turn it over to Dr. Morse to begin.
Good afternoon, everyone. Welcome back from our short break. I'm going to share my screen here. Can you see that okay? I'll take that as a yes.
I can see it, Dr. Morse.
Okay, great, thanks. All right. So if I have any typos, forgive me. I kind of crammed in a bunch of new information here at the last minute, but I'm going to try to give some new updates and just go over a lot of data and information. Data is getting more and more specific to areas, and so I'll recap at the end, but specific conversations about specific districts we'll likely need to do offline individually as needed, because it is getting difficult because each area is getting more and more unique. But with that, we'll get started. So we'll try to keep our questions and answers and things to just school staff and health departments so that we can best utilize our time today and make sure you pass on any needed information to those who might need it. I'm sure a lot of you had heard that yesterday the CDC did make a statement that they still recommend a 14-day quarantine period, but they're giving local and state health departments some options. This is still in discussions between the state and local health departments, so we have not made any changes at this time. We will let you know when we do, or if we do suggest any changes. So please just have some patience. We should have that, I'm imagining, very, very soon. But just for those of you who may or may not have heard about this, we may be able to offer short quarantine times, either at 10 days or at 7 days with testing. There's some major concerns, though, with going to the 7-day period, because even with testing, there's some higher risks of inadvertently causing disease transmission. And I included the data table from the CDC. It's a lot of numbers, I know, but basically, with or without testing, releasing someone at 7 days can lead to a 4 to 10%. When you consider the range, it's really 2.5 to 22% risk of causing disease transmission. So that's even with a negative test result. So I would highly doubt that we'll be seeing a 7-day option. But again, hold tight. We will get that to you. But I just wanted you to be aware that there are risks with shortening quarantine periods. The 10-day time frame, you can see on average, if you don't test people, there's about a 1.5% risk that they could go on and spread the disease. If you do PCR testing, it's 0.3. If you do antigen testing, it's 1.1%. The issue is, as many of you know, to do a PCR test, by the time you get results back, they would have filled their 14-day quarantine. And as you can see with the antigen testing, it's really not much better. And that's one of the issues with the testing options, is there are issues with getting a false negative result. So anyway, we'll be in communication with you. So I apologize. We want to make the safest decision for all of our citizens. The other issue with this, for those of you who are probably aware with dealing with your employees, in October, the legislature passed and the governor signed a bill that's under Public Act 238, which states that your employees who have had contact with individuals who test positive, or really even people that have been in contact with someone with symptoms, need to be in quarantine for 14 days. Now, the only penalty for these indiscretions would be your employee taking you to civil court. There's no MIOSHA that I know of. It doesn't talk, but MIOSHA does follow these as far as I know. But education is not considered essential worker per this act. So we have brought that up with the state, and so the legislator would have to change this wording if they did drop it down to 10 days. So again, this is all hopefully being figured out. I've had questions from all different fields and individuals throughout the community about re-exposures, because we're far enough into this. We're seeing people that have had infections and are being re-exposed. This is very wordy, but I just wanted you to have it as a reference when we send you the slides. It is in the general reference for quarantine, but then there's also a much more wordy, science-y reference for you here. But basically, if someone has had a lab confirmed case of COVID and they are re-exposed to COVID within 3 months or 90 days, if you have to split hairs, of the onset of their symptoms of the first case, or if they were asymptomatic, they do not need to re-quarantine. If it's been longer than the 3 months or 90 days, then they do need to re-quarantine. It's also not recommended that they be retested within those 3 months unless they do have really significant symptoms of COVID and there's really no other explanation for their symptoms. We've had question come up recently because of this. Now it's saying, well, hey, this rule says you have to quarantine. We've asked MIOSHA about this and the state, and they've said, no, you should follow the CDC guidance on that. So I know this is all very, very confusing of what to do with all these different rules, but if they have been re-exposed in 3 months, they do not need to quarantine. We've had some questions too about when might your staff be able to get vaccinated. We expect vaccine to arrive to the state as early as the 15th. The first group, this is from the Committee for Immunization Practices from the CDC. The first group that will be getting it will be healthcare personnel and residents of long-term care facilities. The second group will be essential workers, and they did list the education sector as essential workers. So hopefully you'll be in line after healthcare personnel and before actually then people with high-risk medical conditions and adult over 65. The state has further broken down like this 1A into tiers, like there's tier 1, tier 2, tier 3. I would imagine phase 1B would also be broken down. I would suspect very, very highly that people like police officers, firefighters, correction officers would be first on this list to get vaccinated simply because of the work that they do and the individuals that they come in contact with. So just at this point, that is where your staff are fitting in. So that I find is good news. There's a lot still in motion and nothing is set in stone. So I just wanted to share that. So I just wanted to share a few other interesting things. I have noticed that the CDC schools and childcare program section has a lot of updated and new information. So you may want to go to that section and just click through different things. They have a really extensive section on contact tracing, how to get your school open ready for reopening, how to keep your school open safely, things like that. But a lot of it was updated within the last week or two, or even the end of the end of October. This opinion piece, again, I'll disclaim it as an opinion piece, from the Washington Post is really interesting. It gives kind of a pat on the back to Michigan for, closing non-essential services while keeping schools open. I just found it kind of interesting. And this is from the American Academy of Medical Colleges. And again, kind of talks about what we've learned to date about keeping schools open, and is a pretty positive article. This was written by some public health experts, and again, reviewing some of the newer evidence, and another good read, just basically saying that even as our cases are really exploding, it seems that we can keep our schools open safely. However, I did want to present a counter argument. This was written by CHOP, the Children's Hospital of Philadelphia, their policy lab, which is a group of public health and medical experts that do kind of scientific research and write really good medical reviews on things. And so they put out a very recent article just before the holidays, before Thanksgiving, basically saying because of the huge increases they were seeing in Pennsylvania and throughout the US, that they really recommended reverting to online learning prior to Thanksgiving, and at least until just after Thanksgiving, at a minimum for those that were in middle and high school, which is essentially what we have done in Michigan. And they were suggesting to even consider continuing that through January. And their main concerns were because of the filling hospitals, the colder weather, things like that. It really, unfortunately, they were concerned that with people having holidays, we're just going to see the numbers continue to rise. So I just want to present kind of the other side of the coin, because, things are definitely unpredictable and different now. I wanted to share on our data website from the state. Weekly now, our head epidemiologist, the director of the program, is putting up slides every week that's reviewing our data. And I have some screenshots here I'll share with you, but it's a really nice review of our data. This is copy and pasted from one of the slides. So this reviews our data through the 28th. So basically saying the test positivity has stayed pretty consistent, but it's still over 10%. The amount of testing we're doing has been increasing throughout the state. Obviously, people didn't get much testing done over the holidays. The cases have started to decline a bit, but they're still very, very high. The rates are very high. And, we don't really know what's going to happen once that incubation period after the holidays happens, which should be really any time now. Unfortunately, the death rates continue to go up, and we've seen some of our highest yet. So this is the confirmed cases since early October. This line is the rolling 7-day average, and then the bars are the actual numbers per day. So you can see as we average things out, we are starting to see a dip. Day to day, you see a lot of fluctuation. This I just wanted to put on here because it's a real interesting thing. This point right here is when the new epidemic order came out, when high schools were closed and all our other gatherings were scaled back. So we're starting to see a trend down. This blue line is the 7-day average. This gray box here is basically to tell you this may be an artifact because it takes time for people to get sick. You might have been exposed here, but it might take you 7 days to actually get sick or for test results to come in. So this makes you think, wow, this is great. Cases are really dropping. But in 7 days, these bars might actually go up because they use the onset date, so the onset of symptoms, or the test date. It depends on what's available. But this often gets filled in later. But anyway, this is a promising trend here. Again, it's a little soon to make tons of judgment. This is the percent positivity of our test results. It's a little bit busy, but just so you know, these are the kinds of slides that you can find on those reports. This is extremely busy. I apologize, but I pulled together. This is also available now on the state website. This location is here. And again, you'll get these slides, so you have all these links. But every lab system doing labs in or for Michigan is on there. I tried to pull together the labs that any of your areas might be using. The commercial lab average for Michigan, it takes about a day to ship the labs to the lab, and then just over 3 days for the lab to be run and resulted. So it's about 4.5 days on average. We have some, though, unfortunately, like McLaren Central Michigan, where it's going to be about 6 days for you to get your lab results. And then like Gratiot, it might be 9 days to get results. And we have others where, they're saying, a tiny portion of a day because they might have a rapid testing machine in their hospital or something. But we have wide variation, but I think you would all agree that it is taking quite some time for us to get test results. And most of our systems now are really scaling back and not testing asymptomatic people again and things like that, just because of demand and supply of testing materials. This is the outbreaks that have been investigated. Some, like nursing facilities, long-term care, nursing homes, and schools, they have to be reported. So we get, great, again, it's easier to identify those outbreaks. These others, I'm sure that there are more outbreaks in other settings, but they are harder for us to identify. So I don't want you to get bummed out that there's so many outbreaks in schools. It's just you have to report them, and you do a very good job of doing it. But an outbreak is 2 or more cases, and a lot of our outbreaks that we've had have only been, just a tiny few individuals or just 2 people. So, and I like to remember that one of those cases came from the community, and then they gave it to one other person. So just some thoughts on that. I also put in here, this was from one of her first presentations. So this was data that helped them make the decision about that order. This took all the cases from all the outbreaks in the schools and broke them down by grade level, and really showed that of all the cases in schools, 64% of them were in high school students. So that really helped them to decide that, let's just start with high school for now, in terms of school closure. Very busy again. I'm going to show you another slide here in a second that's a little easier on your eyes, but I just wanted you to have this here when you get your slide deck. But these are all of the hospitals in the 19 counties invited to this call. The link is here, but this is showing bed occupancy. For the most part, we have some little hospitals that might have had full occupancy, but for the most part, the fullest we have is 75% at the most, which is right around the state average. And then this gives information on their PPE supplies. But this is just a little easier on the eyes. Again, this came from that presentation from the state. These counties that are on this call are mainly from Region 6 and 7. We have a few from Region 3 and a few from Region 1. But you can see Region 6 hospitalizations have started to trend down a little bit. Region 7's never been terribly high, but population up there is not as high. And Region 1 as well may be seeing a bit of a drop. So again, just a little bit easier to see than that mess of numbers. This is a little busy. I'll explain it here. This is for the whole state, and we've talked about public health capacity. Of all the cases that have been reported to public health in the last week, well, in the week from 21st to 27th, only 20% of them were completely investigated. And that's just because there's so many coming in, we just can't get to them all. But of those 20% that were fully investigated, just of interest, 38% of them knew where they caught it from. They said, yeah, my girlfriend was sick, or, I went to see my grandma who was sick. A third didn't answer, so we really don't know, but a third of them didn't know. And of those 20%, over a quarter of them were already in quarantine. So over a quarter were already knew they were exposed, were already hunkered down. And so that's a good thing. The numbers are pretty similar to what they were the prior week. So I just wanted to share that information. I do have some numbers for our specific counties that show what our investigation rates are looking like, and they're pretty similar, if not, mostly better. These numbers are not great. I pulled all of our cases for 19 counties for the 2 weeks between the 16th and the 30th. And for the coworkers I have that help pull data for this, I apologize that I went back and kind of did it myself, because I needed a little more consistency for all 3 districts. And it was hard with the holiday week there. So it was a lot of cases to look through and count. So I may have missed a few cases here and there, but just to give you a basic idea. So again, these are not exact to the number, but just to give you an idea. In the last 2 weeks, we have seen cases, some have had more than others, but we have not had huge numbers of outbreaks. And the ones that did have them, this was mostly a couple weeks ago, but of course last week was very short. As you can see, this is the percent of the cases where our investigator did record where they worked or where they went to school. It doesn't necessarily mean that, in 75% of the cases we did not know that. It just means they may not have marked it in the appropriate field of the computer program. But I have to just assume that, 85 to 70% of the time, we didn't know that information. Then this is for District 10. And then for mid. And one thing, you can tell that their numbers are just so much higher, and the ability to keep up with investigating is so much more challenging. The reason I show these numbers is just so that you know with full transparency that we are struggling still to keep up with case investigations. We are still prioritizing school-age kids. But just so you're aware of the volumes that we're getting, and we continue to work on that. So we'll go to our graph here. We still have numbers that are very high. What I wanted to really point out here today, we do see that our cases per million have still gone up a little bit, and our percent positivity has gone up a little bit. This number here is our weekly trend. -1 means that it has gone down since last week. This means that Osceola has gone down for the last 2 weeks. So this is good. We've consistently been seeing that for week after week, these have been positive. So unfortunately, Roscommon has seen increases for the last 5 weeks, and Aranac has seen increases for the last 6 weeks. And we've kind of discussed Aranac has seen about as many cases per day as Clare County, but you can see their cases per million are over twice as many, and that's because they have a much smaller population. Going down here to District 10, same thing. Many of them are seeing decreases for 1 or 2 weeks in a row now. And same with their percent positivity. Their average for the district actually went down over the past week, and their percent positivity has not really changed much. And we will send this table to you. And just so you know, we always keep the prior week. Every week is in here. Every week is in here, just so you know. And mid has gone down on average as well. So they've gone down for the last 2 weeks. And only Montcalm continues to increase on the percent positivity. So there are some glimmers of optimism. Oh, where'd my, there we go. So my closing comments today is we continue to support your K-8 schools staying open after you look at your benefits versus risk consideration. So, as you can see from the data regarding, the test turnaround time, your test positivity, your community rates, the public health capacity, every school district right now is facing different situations. So we're happy to kind of talk individually about your individual school district decisions long term. To try to talk about everybody's needs on this call, I think would be too difficult. So if we could, we'll kind of do generalities, and if we need to talk specifics offline, I think that might be best. But as you're thinking things through, my thoughts are that things to consider would be, the public health strain is continuing. We're not able to identify all the cases that might work at or go to school or have had contact with those working at or going to school. We are continually working on this. We're trying new technologies and new modalities and different things. And I think we're getting better and better, but it's just, there's a certain volume where you just can't do anything about it. So you have to think, are you comfortable and feel like you're able to identify those cases by having staff and students self-report positive cases and symptoms. Even with them reporting, keep in mind that test results are quite delayed. So you need to be comfortable with keeping students home for quite a long time while they're waiting for test results. And then we may be seeing increases in cases due to the Thanksgiving break. And then again, after the Christmas holiday. So those are just things to consider. And then other just unusual things might be, are you having staff shortages? Do you have a lot of staff that plan to go out of the country over the Christmas holiday? Other things like that. So again, just things to think about. Like I said, there were some updated tools and guides on the CDC website that might help you. But that is what I have for today. So we can open it up to questions. Let me see if I can find.
Dr. Morse, would you like me to read the questions?
I can go through them if you want me to.
Okay, either way.
So the first one was just confirming December 5th is when we should receive the vaccine, but again, it will go to healthcare providers first. So it'll be some time before. So it's up in the air as to how things will pan out from there. So in terms of who that includes, that'll be determined. I can't answer that at this point. Do you have any inside track on whether the pause will be extended? No, none of us do. We have absolutely no clue. And that's with regard to whether or not the current epidemic order in terms of high schools being remote and kind of non-essential things being closed in person. So no, none of us have any kind of inside information, unfortunately.
The governor's speaking right now on TV.
Right. And we highly doubt that will be anything enlightening, but we'll see. She does do a press conference twice a week now, just routinely. So do you think the lower weekly rates are a result of truly lower numbers, or are they a result of people not getting tested over the Thanksgiving holiday? I don't know. I would like to hope that it is.
The young to the very old, especially in the Black community.
Can everybody mute their phones or their computers, please?
So I think pretty much half our audience is leaving to listen to the governor, so which is fine. Does anyone have other questions?
There's one you missed, Dr. Morse. It says not COVID related. Yeah, if a parent calls and says student has a cough, this system is a warning symptom. So how long would you recommend they stay home?
If they have a cough that is new or different from them, they need to stay home until they have a negative COVID test or until they have until it's been 10 days.
And then what if a student breaks quarantine and attends a party with other students who are not quarantined?
So if they're in quarantine, they're not ill, then we would most likely notify the participants of that party that someone who was in quarantine attended and have them self-monitor. If that person was ill, well, then they'd be a probable case. We've had people that are in isolation, so that means that they're ill and contagious, who have broken isolation and exposed additional people, and then that puts everybody that they've just exposed into quarantine. But if someone breaks quarantine, you know, again, we don't know if they could be pre-symptomatic, so we usually just notify the people that they've exposed to just be extra cautious, and that, you know, tell them that if the person who was in quarantine does end up becoming positive, that we'd be back in touch with them, and then they'd have to be in quarantine as well.
Okay, it looks like Catherine Rayburn has her hand up. Catherine, do you want to hop on and ask your question?
Yes, thank you. My chat box doesn't work. I had two questions. In the Gratiot County numbers, does that include the positive cases in the 2 prisons in St. Louis?
No, and that's why I was working till the last second, because initially they were in there, and the cases were, I think it had there that we had 1,400 cases. I'm like, how on earth do we have that many cases? So I took them out. We do not count the prisoners because they are only in the prison system. We do count the employees because obviously when they're not working, they're back in their homes. So no, those counts do not count the prisoners.
Do you know if the prison is allowing visitors?
I don't think so. Is anyone from MID or anywhere on the call?
Dr. Morse, this is Haley. I am not aware of any, if they are or are not, so I can't answer that question.
Well, let me go ask my husband since he's a corrections officer. I'll be right back. Hold on one second.
My hunch would be that they aren't, and if they are, it's probably not, physical contact. But yeah, Lisa's got our inside track on the prison system there.
I just had one other question.
Yeah.
On the news, when we watch the news in the evening, they report how many, the number of positive cases are. So my question is, are those positive cases or are they the number of positive tests that were done? So is it an unduplicated count?
The positive cases, any positive lab test, any positive PCR test is a positive case.
I guess my question is, if somebody has to have it done a few times before they get a negative, let's say they had it done three times came back positive, is that being reported as 3 positive cases on the same person?
No, we deduplicate them, and they're not, so those are all yes, they're all single.
Unduplicated counts.
Yes, thank you.
Okay, thank you. That answers my question.
Yep. And if
I'd
they're
like to add to that. Go ahead, Dr.
Well, I was just going to say, if they're retested in 2 months, we don't count that as a new case either.
Okay.
Because we consider that as still being positive from their old case.
Okay, thank you.
Yep.
Also, the local news TV stations often pull numbers from the state website that often are different from our numbers because we investigate our cases, and oftentimes cases will get shifted if we determine they are not part of one of our counties. So the state numbers don't always match our local numbers. So keep that in mind.
This is Lisa from Mid. Yeah,
Okay.
They're not allowing any visitations at the prisons in St. Louis.
Thank you.
Thank you. Next question, Dr. Morse, do you recommend schools follow the revised CDC quarantine rules for the number of days or stay with the 14 days?
So as mentioned before, stay with 14 days until further notice. If there's any changes, we will let you know.
Okay. Next question, can the health department send out guidance to consider for opening and closing, something we can work with our school board to make good decisions based on our circumstances and data and not emotion?
And that's where I struggle, because I don't know that there is a specific if this then that answer. And we've all been looking for that, and it's really elusive. There's so many different factors that come into it. I can talk with my health officers and see what we can do. But I was hunting for that over the last few days to see if there was any better new guidance out there. Because it is so multifactorial. It isn't just about like your county incidence or your percent positivity, but it's so hard to put it into.
Our state chose not to wait.
I'm going to give this to you because I want to listen to the school call.
What's that?
It looks like somebody's unmuted.
Okay.
So Hillary followed up saying something like the slide you just posted about things to consider with recommendation points.
Okay. Yeah, I can work on that and even collaborate with my other medical directors. I had posted something 2 weeks ago that was from the policy lab, which is who I just talked about today, where they had kind of some thought points. So I will work on that as best I can. It's a tricky one.
Dr. Morse, this is Marcus Cheatham. You know, reopening buildings isn't just about COVID cleaning, which in fact may be less risky than some other things. So environmental health directors might also want to weigh in on, you know, water supply and things like that. Also, I think that the person asked in their question about emotion, the risk of emotion guiding policy. And I think it would be helpful to know, and you don't need to say this now, but you might email it to your local health department. What are the things that school boards might be disturbed about that we could be reassuring about if we knew?
Well, and that's the tricky thing, is that as soon as that question came up, I thought, oh, I'll get more angry emails from teachers, because after one of my last talks, someone emailed me and said, I'm not using science, I'm using politics and economic arguments. And so I know no matter what you do, someone's going to be unhappy. So that would be good, I guess, is to know what emotions we would need to address, because even when you do use scientific discussion, it isn't really seen as that, or it isn't really appreciated as sufficient.
Okay, it looks like Cecily, last question listed here. What we are going to be seeing in the next few weeks are what we see every year: cough and runny nose. How would you recommend handling this? Are we supposed to tell every student that has a cough or runny nose and the parent keeps them home for the typical day or two to go to the doctor before they can return?
Yeah, and it's going to be difficult. It's going to be very difficult. So if they have a new severe cough, they are to get a COVID test before they come back. I'm not sure what county you're from, but we are starting to talk about some options where we might be able to assist you with having COVID testing available at your school, so that if you had sick kids, you could test them right there. But unfortunately, the only way to keep COVID out of your school is to require that those kids that have symptoms that could be COVID not be in school until you can show that it's not COVID. There's really no other way to do it.
Okay. Lynette Gardner has her hand up. Lynette, do you want to hop on and ask your question?
Did I get in there?
Oh, there you are. We can hear you.
Okay. I was pushing the wrong button. I ended up joining late, so I don't know if the question got asked, but does the October 29 order from the health department, from the state, supersede the 2020-142 order? Or so does it overrule it? I had somebody say that the 142 said that we have to have students who don't want to wear a mask get a medical note from a doctor, but yet the order on the 29th says that you can accept a verbal authorization.
So I'll provide you the link to the FAQ. They are saying, how is it worded? You can require a note. You don't have to require a note, is basically how it's worded. Addressed in the FAQ for the epidemic orders.
Okay.
But I'll find the link.
Okay, I couldn't find anything, so I couldn't figure out which one was the one.
I don't. It's not like there's a million things on there or anything, right?
Well, yeah, and then when you have somebody say, well, no, it's this one, and somebody else says, no, it's that one, then you're like, okay, aren't we supposed to be following the newest one?
Okay, Dr. Morse, Lisa Seeley mentioned that she is from Gratiot County, just so you know.
Yes. And I was going to say, you know, with Gratiot County's current incidence rates, you know, that's another thing to consider. You know, they have very, very high rates of COVID right now. So that's just something else to take into consideration.
Well, that was the last question listed. Does anybody else have any questions you want to put in the chat box or unmute yourself and ask directly?
And before anybody does, I'm not very good with Teams. And so I copied and pasted that FAQ right into the chat. And then below that, I posted the link. But to find it, you just go to the michigan.gov/coronavirus and click the top says resources. And then there's a tab that says state orders and directives. Click the epidemic orders. And then under the November 18th, there's one that says November 18th FAQ, and it's in there. So.
Any other questions from the group? Well, Dr. Morse, we're not hearing any.
All right. Well, thanks for joining, and we'll keep you posted if any quarantine rules change or anything else before next Thursday.
Thank you.
Thanks.
Thank you, everybody.